And welcome back to ABC-7 at 4. We may be in the middle of a pandemic, but as National Women's Health Week comes to a close tomorrow, there should be a renewed focus on women's health. Joining me now is Dr. Sarah Ann Schumann. She is the Chief Medical Officer for Oklahoma and North Texas with United Healthcare. Dr. Schumann, thanks for joining us.
Thanks so much for having me.
Well, doctor, it's very apparent that women are under a lot more stress these days between working from home and taking care of the family. So let's talk about the three things to consider to help support women's health. First of all, you say they need to take advantage of technology.
Yes, absolutely. So when during COVID, we know that many doctors' offices were closed. And so this is a great time to learn about telemedicine. And I think in the past, people knew about telemedicine for urgent visits, but now some women who are pregnant are even having their prenatal visits by telemedicine or having their chronic conditions like diabetes taken care of by their doctor remotely using their smartphone or tablet or computer.
Now,
and another thing
I'm sorry, go ahead. I'm sorry.
Oh, sorry. Another thing with technology are mobile apps. There are lots of great apps for pregnant women that will teach women week by week about their baby's development and even track their weight and give them tips on how to stay healthy during pregnancy. So we recommend all of those.
All right. Now, second, you want women to take charge of their health while they're at home.
Yes. Women are very good at taking care of others. We know lots of moms are taking care of kids, but it is really important for people for women to take care of their own health and think about things like healthy eating. Make sure you're getting lots of fruits and vegetables. Make sure you're getting some kind of exercise. It's a great time when gyms are closed or if people don't feel safe going back to gyms to get outside and take walks and take the family for walks as well. Of course, also make sure that you're not smoking, or if you do smoke, please try to quit or cut back. And that would include vaping or e-cigarettes. That's always unhealthy, but your risk for COVID is also higher if you smoke. And for pregnant women, we really want them to stay away from alcohol completely because not even one drink is safe if you're pregnant.
And third, even with social distancing, it's still important to stay social, right?
Very important and relevant. You were just talking about a new way to stay social online. You can have virtual dinner parties or play dates. And as the social distancing restrictions are lifted and people are getting out, make sure when you do go out and stay social that you're doing it safely. And, if you want to meet with other friends or other families, doing it outside when the weather is good is great, and make sure you're staying 6 feet apart. And if you and the people you're with are wearing masks, your risks for getting COVID infection is much, much lower.
Dr. Schumann, do you have any other tips you'd like to share with our viewers?
Well, I think this is a really, really stressful time. So just make sure that you're doing things to take care of stress. I think even just simple breathing exercises, taking a couple deep breaths, getting exercise, eating healthy, all of that is going to help us stay healthy in this really difficult time.
Some good advice. Dr. Sarah Ann Schumann with United Healthcare, thanks for being on the show today, and take care.
Thanks, you too. Have a great week.